Hello, everyone, and welcome to Birth and Baby Talk. It is Wednesday, February 17th. I can't believe we are halfway through February already. And we are back this week. Meghan Bowser-Taylor, who is one of our hosts and owner of Family Doulas of Ottawa, and myself. I feel like you guys are going to start getting sick of me. This is like my fourth episode in a row. I don't normally get to be here this often. It's so much fun. But this week, it is all about multiples. This is an issue, despite the fact that Meghan and I have only ever had singleton babies, that I think is near and dear to our hearts, because multiples parents have a whole different kind of road ahead of them that in some ways is a bit more challenging, and in some ways is actually a little bit easier. So without further ado, Meghan, I will let you introduce yourself.
Yeah, hi everybody. I'm Meaghan from Family Doulas of Ottawa, and yeah, other Meaghan. So we're both Meaghan. So it should be a very confusing show. She's right. We just have singletons, but we have lots of experience with multiples. Personally, I have a lot of experience with twins. Meaghan might have done triplets and quads and other types of multiples.
I will admit my cap has been at triplets.
Okay, so triplets are always
wet. But twins and triplets are definitely on my resume. And when I Meaghan, you didn't even know this. I told you this the other day, and you were like, I didn't know that. When I started my doula career in Toronto, I actually sort of inadvertently fell into supporting primarily multiples and high-risk pregnancies. So I spent a lot of time in the multiple clinics at Sunnybrook and Sinai and a couple of the other hospitals, because that was my bread and butter as a doula. That was, the majority of my clients. So I have a lot of experience on the birthing side of twins, especially. And Meaghan, I know you have a lot of experience on the postpartum side of twins and taking care of them once you get home. So why don't we start from the beginning? Twins, I mean, this is a topic we could probably teach like 50 different episodes on. I'll start with the super basics in terms of types of multiples, just so everybody is on the same page. So multiples sort of go twins, triplets, and they're called higher order multiples. So this is anytime you have 4 babies or more. Within those categories, you have identical, you have fraternal, and within identical, you have a couple of different types of identical twins. Primarily, or triplets or babies. Primarily what they are looking at is how many gestational sacs, so that's the amniotic sac that goes around the baby, and how many placentas. This is the big question when it comes to multiples. When they do that initial ultrasound and they go, surprise, there's baby A and there's baby B, and most parents look at the ultrasound tech and they go, pardon me?
What?
What do you mean baby B? So once they've determined that you are carrying multiples, the next thing they want to try and determine is what type of multiples you are carrying. The reason for that is some types of multiples have higher chances of complications and risks compared to others. Lowest sort of risk, and fraternal twins with separate sacs and non-fused placentas, and everything is sort of separate and individual. These are actually considered the lowest risk multiples. These are babies that often are born vaginally. These are not babies that have to be born surgically or via cesarean. As long as baby A is head down, these babies can typically be delivered vaginally. And they're often, these are the babies that go 37, 38, 39 weeks gestation.
Yeah, like full term,
these are full-term babies, even sort of in terms of singleton gestational age. These are babies that are typically born full-term, not always, but typically. So they're considered the lowest risk. Now, that being said, the way our medical system looks at twins and multiples in general is they are all considered high risk. They are all sort of subject to additional monitoring. Your doctors want to keep an eye on your cervix and make sure that your cervix is shortening too early. They also want to make sure that things like your blood pressure are not rising, gestational diabetes. I always tell people, the more placentas you have, the more chances for things to happen. So the more placentas you have, the higher your chances of gestational diabetes, higher your chances of preeclampsia. So doctors want to keep an eye on that. Even if you have like the healthiest, lowest risk twins, there's still 2 placentas. So there's still opportunities for things to happen. Once you move into identical twins, or triplets or whatever, you start to get a few more questions and challenges. Here, some identical multiples, depending on when the eggs split, will have completely separate gestational sacs and placentas. In terms of identical babies, you actually won't even know these babies are identical until they're born and until you do some genetic testing. Because from an ultrasound perspective, they're completely separate. There's no way of knowing that they're identical.
Yeah.
From there, you then start to get into more challenging territory with shared placentas or shared amniotic sacs.
Yes.
Shared placenta can be a challenge. This is where a lot of twin moms or people who have sort of done the research on this is why we talk about twin-to-twin transfusion syndrome. Mm-hmm. This is where one baby takes the bulk of the resources from the placenta, setting up that sibling rivalry early. But it's a thing that happens. It's something that is monitored for very, very closely because it can be quite dangerous for the baby and typically results in delivery. Once doctors see twin-to-twin transfusion syndrome occurring, there are surgical procedures that can help sustain the pregnancy longer to get the babies to an older gestational age. But those procedures are not always right for every patient and every set of twins and every pregnancy. So there are a lot of times where this just results in an early delivery. The other one, and I almost wish I had pictures of what it looks like when babies share a sac. You ever seen the Gordian knots?
Yeah, it's cool.
You actually know what it looks like. So everybody, if you look up, like if you go to like West Coast Kids or whatever, you see those the balls, the pillow balls now that are like the tubes that are wrapped around each other. That's what the umbilical cords can look like when babies share a sac. They're called Gordian knots. And as the babies sort of somersault around each other when they're small, their umbilical cords actually tangle and knot and get all in and around each other. And which
is not so cool in the end.
It's super cool. It's not a cool thing.
It's not cool, yeah.
Cord accidents are, one of the primary risks with multiples. And I will say that, even in healthy fraternal, no sort of risks, cord accidents during, or cord concerns during birth are not uncommon. Cord prolapse, when the cord slips below the baby's head into the birth canal, is quite common with baby B in a vaginal birth because all of a sudden there's all of this space. Baby B hasn't had that much space ever. So baby A comes out and then there's a whole womb there and there's just a lot of space for things to happen. So, when we're looking at twins or multiples, we really sort of look at the types of multiples that we are dealing with in order to determine risk. Now, within those sort of shared placenta, shared gestational sac, those are called MOMO, MODI, DI. It's a whole language in and of itself. If you are a multiples parent, you know what I'm talking about. These types of multiples also apply when you have more than 2 babies. So we talk about twins just because it's easier to talk about baby A and baby B. Once you start getting into triplets, quads, other higher order multiples, it can be any combination of these things. So you could have a triplet pregnancy where 2 of the babies are identical and the third is fraternal.
Fraternal, yeah.
And you can have, and those 2 identical babies can share a placenta and a sac, and the fraternal baby will have their own. So, there's lots of different, the more babies, the more sort of these things start to happen and the more sort of concerns OBs and MFMs, who are maternal fetal specialists, have to manage. Now, if you find out everything is good, everyone is healthy, but you are pregnant with multiples, depending on who your care provider is, things might start to look a little bit different. While midwives often will do the first and second trimester care. Generally speaking, multiples patients are referred to either an obstetrician or an MFM by their third trimester to be overseen for their last trimester of pregnancy. And those are typically the healthcare providers who will be delivering your baby or babies. That being said, if you were registered with midwives before and you have to have this transfer for your third trimester, you are usually able to transfer back to your midwives for postpartum care. So this means that, you've had your transfer, and just like if you were transferred to an obstetrician for a cesarean in labor, once your care with that person is done, you're transferred back to your midwives. Generally speaking, we see that same ability with our twins and multiples clients in, our agencies, that they're able to go back to their midwives and get that sort of really hands-on postpartum care that a lot of people love.
Yeah.
If you were with an OB or family doctor to begin with, you're just mostly going to see a step up. Now, pandemic aside, because appointments and pandemics and how that is all working is going to be based much more individually now than it has been in the past. That being said, typically we see the biweekly appointments start earlier in the process with multiples. We also see more frequent ultrasounds. It's not just sort of 12, 20, and maybe 32 weeks. We often start to see it at every appointment, particularly once you start to get closer to your third trimester in 28 weeks. They really want to keep on top of whether or not there are any cervical changes, sort of indicating labor, particularly because the goal is always to have babies with fully developed lungs. That is sort of the goal of a
gold standard.
The gold standard of a multiples pregnancy is to have babies born with fully developed lungs. Now, if we have sort of a good heads up that labor is happening or coming, then medications can be given, steroids are given to help develop babies' lungs. That is my beagle howling in the background. I apologize for not walking across the street. And my husband's in court and I'm on this. This is, anyways.
It's a mess.
Pandemic life.
Yeah.
We see these ultrasounds start to happen more often. They really want to keep on top of the cervix and any signs of labor coming so that they can give any steroids that are needed to help babies' lungs really get into the best possible place before they're born.
Yeah.
Once, let's say everything goes smoothly, you have your babies. Now, good thing to know, singletons are born at an average gestational age of 38 and a half weeks. Twins are born at an average gestational age of 35 weeks. Triplets are 32, and quads are 30 or earlier. So the more babies you have, the shorter gestation we expect. And honestly, the shorter gestation, the body can tolerate. When you are growing 4 human beings, that is a lot of strain on the gestational parent's heart, their lungs, their circulatory system, their joints. So these are people who typically end up on bed rest, often in the hospital. Very closely followed. And we do see these babies come earlier and earlier depending on how many you have.
Right. And if you do make it, like if you just have like twins and you make it to 34 weeks, that's a good thing. Like we have lots of twin parents who are like, that is kind of, if they made it to 34 weeks, it's a really good turn.
34 weeks is when most MFMs won't give steroids. So as long as your baby is 34 and 0, or babies, as long as your baby is 34 and 0, they won't always give steroids because often at that point babies are fine. At 30, they also won't try to stop labor. Right. For anyone who is expecting multiples and you've watched Hollywood and you're like, but they can just stop labor. That is so not how it works. Stopping labor is usually more of a delay tactic than an actual cessation of labor. Yeah. Once labor gets started, it is extremely difficult to stop. It's a little bit like snowball at the top of the hill. You might slow it down, but you're probably still going to have an avalanche at the bottom. And the avalanche is your babies. So once you are in labor, I'm going to go with the idea that you are having a vaginal birth. That's typical with twins,
Yeah.
as long as they have separate sacs and separate placentas.
Yeah.
You see vaginal birth, you are going to be monitored even more closely in labor. So if you've had a singleton baby in the past, this is going to be quite a different experience for you potentially. With multiples, it is strongly encouraged by most hospital care providers to have an epidural.
Mm-hmm. And that's too, it's important to point out too that you're often in the OR, even if you're having a vaginal delivery. So because just in case baby A comes out vaginally, but baby B decides they want to take a different route. And so, yeah, you have an epidural to prep you as well for that.
Yeah, there's a lot of reasons for it. The biggest is if baby B decides to act up. Then if the epidural is in place, it is much faster to increase the amount of ventilation in an epidural. It is to administer an epidural or a spinal. So we recommend that you sort of go into labor and get your epidural fairly early in the process. Now, if an epidural isn't something you were hoping for or looking towards, we have seen people who have the epidural placed and not used so that it is there. I will be honest that most people, when they're pregnant with multiples, are ready to just kind of put their feet up.
It's a lot, yeah.
A lot, and don't have as much freedom of movement with multiples because in addition to the taco, which is the hockey puck that monitors your contractions and is often sort of at the top of your bum, you will have a monitor for each baby. So each individual baby has to have their own heart rate monitor. So if it's twins, I mean, that's only one extra. If you're monitoring triplets, you now have 4 monitors.
Oh, right, yeah.
Contraction monitor. So now you've got 4 hockey pucks strapped to your belly, and all of those are wired to the computer.
And if anyone has even for a singleton, if anyone's had continual fetal monitoring, you know what that strap feels like. So imagine that times like 4.
I find them itchy. Like it's like that weird crack, like where your back. It's awful. They're not comfortable.
Yeah, it's a lot.
And for people who are looking to avoid epidurals, a big part of what their coping plans are is movement, being in the water, being able to sort of walk
around.
You've got multiple heart rate monitors on your body, or at least not as easily. So we can create sort of a very different dynamic than people were potentially hoping for in labor. And then, as Meaghan said, you get much closer. They say you're 10 centimeters. It's time to start pushing. And then all of a sudden, there's like 30 people in your hospital room. And they're like shoving everything you own underneath your bed. And then they're wheeling you into the OR and you're a little like, what just happened? And there's now these bright lights in your face. And depending on your hospitals, some hospitals, even delivery in the OR feels quite a bit like a typical birth. You will be moved to a surgical table. It's not comfortable. It is very narrow. You will probably feel like you're going to fall off. That is because they need to do surgery. Having your arms out like this is a lot more exhausting than having your arms like this. So,
and you're like flat on your back too. So that creates a lot of for a lot of people, that creates a lot of nausea and discomfort too. And then if you have obviously double the baby in there, it's quite a lot.
And depending on your hospital or even just the care provider who is on call that day, we do, at least in Toronto, we do sometimes see the boot stirrups used. So the inflatable boot stirrups. To help the circulation in the feet because it's anticipated you'll be pushing for a while. So I have seen those used. It really is sort of provider dependent. All of the hospitals have them. Not everybody uses them. So something to be sort of aware of is you may see stirrups used. You may see these big boot-like contraptions used that your legs go into. That's partially about helping you to stay in the right position and not fall off, and partially about circulation while you're pushing. And then once baby A is out, you often don't have time to do the same kind of skin to skin that you would do with a singleton. And there's a couple of reasons for this. The first reason is chances are your baby is probably at least a little bit early, and so respiratory therapists want to check your baby first. So your baby, especially because you're in the OR already and the warming station is right there, a nurse and respiratory therapist will take your baby over to the warmer. They will clear out any mucus. They will rub your baby down. They will check your baby out. And if things are good, then they bring you your swaddled baby. Chances are while they are doing all of that, you are busy delivering your baby's sibling. And baby B is where things often go sideways and pear-shaped. So if things suddenly amp up between babies, it's not, I mean, I'd love to say don't freak out, but that is probably not going to happen because it's your baby and scary things are happening. No, what is important to note is care providers know that baby B acts up. They know that all of a sudden, all of this space, all of this room, it's a very new sort of experience and feeling for the baby, and things can happen. So they are really on top of baby B. Often we see I'll call it medically managed delivery of baby B. If that baby is breech, you will sometimes see care providers internally turn baby, which, yes, everybody, that is exactly what it sounds like. So you can cringe right now.
It's a hard thing to hear for sure. It's a hard
thing to watch. It's a hard thing to go through. I suspect it's a hard thing to do. Like, you're kind of up to your elbow. So, you know, it's not the most pleasant experience ever, but it really is about putting baby down as quickly as possible. I have also seen breech deliveries of baby B, depending on position and how fast baby comes. The good news is pushing baby B is way easier than pushing baby A.
You've already because baby A has already cleared the runway, basically, right?
Description cleared the runway. That being said, as much as I have all just said baby B comes super quickly and they really medically manage it, I have seen situations where baby B takes their sweet time and an hour later we're like, okay, maybe up that Pitocin, where is this baby? You don't get to have a different birth date. It's time to make your appearance now. So we do sometimes see that delay. The other thing to note, your placentas will both be delivered after both babies.
Yes, yeah.
So they don't do baby A and then baby A's placenta and then baby B's placenta.
That would be really funny. That'd be really weird.
It's, although I sometimes wonder when there's this big long delay between the twins, I'm like, but if the placenta doesn't come out, then what? Because everything we learn about singleton birth is you want that placenta to come away within a certain period of time, or you run the risk of uterine bleeding and bogginess and all of that. Obviously, when you are still contracting around a baby, that is not necessarily the case. But we also sometimes see labor slow down between baby A and baby B. Kind of like the uterus goes, I've done my job. No, there's a whole other baby or two behind that. Now, if you're having triplets or higher order multiples, most doctors in Ontario deliver those babies by cesarean. I don't think I have ever seen a triplet vaginal birth in Ontario, at least not that I have been present at and that I am aware of. And quads absolutely would be delivered by cesarean. Especially because once you're looking at 3 or more babies, you are looking at much more premature babies who may not be able to tolerate the stress of labor. If you've ever been one of my birth clients, I will tell you that it is a marathon that both you and baby are running. Babies who are very premature, whose lungs are not fully developed, may not tolerate the stress of labor the way a full-term baby will.
Yeah, exactly.
So those babies are born by cesarean, and when that happens is based on all of that continuous monitoring and ultrasounds and all of that happen throughout your pregnancy. Your babies are here.
Yay!
The good news the silver lining of having premature multiples is you don't have to bring them home right away, and you can get used to caring for multiple babies with support.
Yes.
And this is a huge piece because going from no babies to triplets, for example, is a big shift in your lifestyle.
Yeah.
And it can be a bit of a shock, especially if you're recovering from a cesarean birth and you're just getting out of the hospital, you've had a harder pregnancy. So often these babies spend at least a little bit of time in the NICU.
Mm-hmm.
The NICU is the neonatal intensive care unit. Some hospitals call it the special care nursery.
Mm-hmm.
Same thing. Depending on how early your baby is, depends on what level of NICU they need. Sometimes babies who are born prior to 32 weeks will be transferred to a different hospital. They're looking for a higher level NICU. I don't know which is the tier 1 in Ottawa. I can tell you in Toronto that Sinai, Sunnybrook, and Sick Kids are the 3 top tier NICUs.
Yeah, and we have the general, and the civic too, as well, is considered a top tier for the NICU. Yeah.
So these are where babies are going to be transferred if they are born before 32 weeks, and that's just because those are the NICUs that have the most experience with what are called extremely premature babies, or early preterm babies.
Mm-hmm.
So they spend their time in the NICU. Sometimes these babies are called feeders and growers, which I always laugh at that phrase.
That's cute.
Makes me think of those, like, remember the toys you dropped in water as a kid and they
like expanded?
Like slimy rubber. I'm like, it's like one of those. You're feeding and growing it. This is where you're looking for babies to really just put on some weight. You want them to get a little bit fluffier, and you want them to be breastfeeding or bottle feeding or both.
Yes, yeah.
Other babies obviously have more medical concerns. They need to be there longer, whether it's for lung development or any number of other things that can come up. Premature babies are highly prone to hospital-borne infections. So that is something that is monitored very, very closely when they're in the NICU. And then sometimes, and this is sometimes the hardest part for parents of multiples, babies do not always go home at the same time.
Yes. Yeah. Which actually can be like a blessing and a curse at the same time. So I think there's some, like, we've had some clients where they've had babies in the NICU where obviously like one baby has just like gained a little bit more weight, is a little bit stronger, and like kind of made like their way out of the NICU. And so they do get to have some home time with that baby, especially if they're first time parents, and kind of get used to what that looks like. But on top of that is still, one parent, usually the birthing parent or, the whoever's feeding the baby, is then going back to the hospital like multiple times a day or for really long periods of the day and leaving the other baby at home with their partner or someone else. So I've heard both stories where it's like really sad to leave one baby at the NICU, but also a little bit easier to kind of like slowly get used to being a parent as well.
There's definitely silver linings to it. Like you said, you get to ease into the routine. You get to get one baby used to the new environment and new space before you bring any other babies home. That being said, there is, and this is true regardless of whether all of your babies are in the NICU or just one of your babies is still there. There is a very hard emotional hurdle, I'll call it, over leaving your baby and going home from the hospital. And so just to acknowledge for multiples parents, whether this is upcoming or something you've experienced, NICU in and of itself can be a traumatizing experience, not because the doctors and nurses don't care. They're wonderful. They're there because they love babies. Like it's not a mean unit. This is people who genuinely care and really want to help families.
Yeah.
At the same time, it's hard. You're leaving your baby behind. You're not with them all the time. You're depending on other people to care for them. And there's a huge sort of, and also the unknown of all of the medical stuff and the beeping and the tests and watching, newborns, especially premature, the IV doesn't go in the back of their hand. It goes in their scalp, which is really overwhelming to see. So there's a lot wrapped up in the NICU experience. If your babies need NICU time, I always encourage our clients to talk to the hospital social worker. That's
because
they're there for.
Yeah, it can be really challenging. Like I've had a few clients where, they went to the NICU to see their baby. after the other baby's been discharged, or maybe before, maybe it was both babies. And they couldn't hold the baby. Like, it was the one day, because sometimes you can hold the baby and do skin to skin. Some days you can't. And it was always really hard the days that they couldn't hold the baby because, for whatever reason, the NICU nurses, wanted the babies to be, I call them an incubator. I know that's not the right word, but that's what I call them.
I think we all do.
Yeah, in the warmer.
And so, isolates, but yeah.
So as a parent, that can be really hard because your instinct is that the safest place for your baby is with you and like on you, and you're responsible for the baby and you're supposed to be taking care of the baby and keeping the baby safe. And then to have the NICU nurse be like, you know what, not today. The best place for the baby is in the warmer. And so that can be really challenging for parents as well, and really emotionally draining. Right. And especially in COVID times, especially because not just like getting into the NICU and being with your baby, but the actual steps to get into the NICU is daunting, right? You have multiple checks. You have to go through multiple checkpoints, get your temperature taken, like fill out forms. And that's every single day you go. So it can be really challenging for parents.
And with COVID, a lot of hospitals, knowing that they cannot say you can't come see your baby in the NICU, are limiting it to one parent. And it's not a rotating basis. You're basically declaring which parent will be the NICU parent.
Parents, yeah.
And there's not sort of an opportunity to say, oh, I need to be at home today to rest. So the other parent is going to the NICU, which you could do in normal times. You know, often how parents worked it is, I used to see, mom would go during the day and partner would sort of come in and relieve
night,
evening and do everything after work. So like there were lots of ways to make those schedules work so that babies had time with both parents and both parents had time to rest.
Yeah.
Not so much the case right now. And that adds an added layer to all of this that can make it very difficult.
Absolutely.
That said, multiple survival rates in Canada are phenomenal.
Yeah.
Our healthcare system really, truly is set up to manage and handle and support these babies and these families. So even if your baby spends time in the NICU, the chances that your baby is going home healthy and happy are great and very, very high. And so that's when, sometimes people are like, I got through the pregnancy, I got through the NICU. This is the easy part, right? I mean, as much as parenting is the easy part at any time, but now you've got double the trouble and double the love, or triple. And that means double the crying babies, double the number of diapers, double the number of diaper blowouts.
Yes.
And a house full of baby equipment that you never had any idea that you needed or frankly existed.
Yeah,
there's some interesting products out there specifically aimed at multiples.
Yeah, and I mean, it's funny because everyone's like, I'm having, like for argument's sake, let's go with twins. I'm having twins. Do I need 2 of everything? And like, the answer is yes and no, right? Like there are some things you for sure need 2 of. Like you definitely will need 2 car seats. Absolutely. If you have a car, if that's how you're traveling. You definitely, and I want to say before you go buy stuff, you should ask your local stores about their twins discounts. Yes. Lots of stores will do twins or multiple discounts. So absolutely ask when you go in.
I'm going to jump in on the car seats.
Yes.
Car seat safety tech I can't not. So a couple of things to note. A, you should have car seats for every baby, regardless of whether or not you have a car. NICU grads, they're always called graduates. NICU grads in particular almost always have to pass what's called the car seat test in order to be discharged from the NICU. So that means that they are placed in the car seat in the appropriate position, and their oxygen levels are monitored to make sure the baby can tolerate being in that semi-reclined
Position.
with sort of pressure on their neck and upper chest.
And isn't there like a timing that they do too? Isn't like a time that they
an amount of time? They have to be able to be in for a particular amount of time with their oxygen stats staying at a particular level before they can be discharged.
Yeah.
The other thing to note with twins is you always want to make sure that the car seats you buy are safety rated from 4 pounds up.
Right.
Because multiples are often born prematurely, you are sometimes bringing home very small babies. And not all car seats are safety rated for as low as 4 pounds. So those are sort of the things that you need to be aware of when it comes to twins and car seats. You always have to have a car seat for each twin or each baby. And you do want to look for ones that are safest for the smallest of babies in case yours is one of the smallest.
Yeah. Yeah. I mean, I didn't even think about the 4 pound thing, but yeah, obviously, because there's lots of twins who come home like at a really low, like a lower weight.
I learned that lesson when a client of mine learned it the hard way.
Oh, okay. And sometimes we do learn things the hard way.
Well,
right?
And I had a client, the family, they had bought their car seats. They thought they were good. They were expecting fraternal twins, so they sort of anticipated full term.
Yeah.
When their babies came early and their car seats were from 5 pounds up, and one of the babies was ready to go home at like 4 pounds, 10 ounces or something. Oh. And so there was this big scramble of how do we get a car seat? Get this baby to pass their car seat test and then get home.
Yeah.
So it's just sort of one of those things that I always tell people to note. And you're right, Meaghan, there are lots of things you need 2 of. There are lots of things you don't. For everybody who's watching that little banner scrolling at the bottom where it says you want to get our handouts, click here. There will be a handout this week on setting up your registry for multiples. And it's going to talk about the products you need one of for every single baby, the products you just need more of.
Right, yeah.
You really only still need one of. Like, you don't need multiple baby monitors. You don't need multiple, diaper pails unless you have multiple changing stations and you want a diaper pail at all of them.
Yeah.
So we're going to have that handout in this week's newsletter. So for anyone who's expecting multiples, you definitely want to make sure you are signed up so that you can get that this week.
Perfect. And that's good because then you can have like a full-on list that you can actually take to your online shopping, I guess now, depending on where you live. Yeah, but definitely like Meaghan's absolutely right. There are things that you will for sure need 2 of, but a lot of times you just need extras, right? Like you'll need extra receiving blankets or extra onesies or extra diapers. Like it's just a little bit more. And that just depends on how much laundry you want to do as well. So yeah.
Why don't we talk about sleep surfaces and multiples? Because this is one of the big controversial. Every stock photo I have ever seen has twins in the same crib.
So, and it's interesting too, because there are a lot of twins where, studies have shown that if you put them like head to head or next to each other in a crib, they calm down instantly. But that is not like this, that's not like the gold standard. And it really depends on the twins too, right? Like there are lots of twins, especially preemie NICU twins, who have been separated for various reasons. And they don't necessarily have that same comfort about being together. Not that they like don't want to be together, but they just don't like instantly fall asleep when they're right next to each other either. So I think that that's kind of like a bit of a myth that happens.
There are definitely multiples. I've even seen babies who have been separated in an ICU, whether it's in different rooms, if you're somewhere like Sunnybrook where each baby sort of gets their own little room, or in a much more open NICU, where babies are in different isolates and there's a little bit of space between them. Even they will often, you put them beside each other. They spent 9 months hanging out together. They will calm down. They will smell, see, hear each other. And that is a calming effect. Here's the thing. We also know that a baby sleeping on their belly means they're going to sleep better and be calmer. And we don't do that because we know for safety reasons that we shouldn't. Safety guidelines and safe sleep guidelines for multiples are the same as they are for singletons. Yeah. Every single baby should have a separate, flat, unencumbered, so nothing else in there, including another baby, The baby counts as a thing in the crib.
In the crib.
There's 2 babies there. It is not an unencumbered sleep surface. Now, that is a hard thing for a lot of multiples parents because multiples are exhausting. You're up for a longer amount of time to make sure everybody is fed, and they sleep better when they are beside each other. There are products out there. I will be honest that I'm a little bit skeptical on some of them from a safety perspective, but there's actually a Halo bassinet that's a twins bassinet that has a mesh sort of divider between the two. There are larger pack and plays that you can do the same thing. What I will warn everybody about is the pack and plays that have the 2 sort of top attachments are not safe. Those are not safety rated for sleep in Canada. It is not a safe sleep surface. The sort of baskets of them are too soft. Its baby can't lie completely flat, and that becomes an asphyxiation risk with their neck and throat and breathing. So those like twin to go pack and plays, great pack and play, don't use the twin top part.
For the sleep,
They're not safe. Honestly, I wouldn't use them at all. It's not even just not for sleep. Like, you can only, they're so much shallower than even sort of a typical bassinet that you couldn't, as soon as baby starts wiggling, you wouldn't be able to put them in there. You know, baby doesn't have to roll over. There's this, the baby I'm currently working with, she starts the night at the top of the crib and she wiggles her way all the way down to the bottom by the time she gets for a feed. And I'll watch her and I'm like, you were 2 feet higher up like an hour ago.
Yeah, it's funny to watch them do that.
And here's the thing. That's why it's not safe, because babies wiggle and babies move and babies fling their arm like this and cover their brother's face with their sleeper covered arm. You know, these things happen. So we really do always recommend car seats, sleep surfaces. These are things every baby needs to have their own of.
Their own of, yeah, absolutely. And it's nice too, like even like, and you don't have to like, you know, everyone's always a little bit worried about like how expensive twins are, but there's lots of places too where you can get a discount. There's lots of multiple groups in various communities where they will like donate to each other, you know, or lend stuff out so that you could use it for like, especially with bassinets where you're only going to use for like a 3-month period, maybe. And you don't want to like invest a whole bunch of money in it. Like reach out to your local multiple groups. Whether that's on Facebook or in like your parenting groups, and just see if there's some like extra stuff that people can lend you for those small little chunks of time.
I don't know. Obviously, this year is different. I feel like that's the caveat to everything.
I think you should just say that before you say anything.
I know. The caveat to this entire conversation is COVID has thrown everything out of whack.
Yes, yeah.
A lot of, especially in urban centers, Ottawa, Toronto, I'm fairly certain Hamilton has one as well. The Parents of Multiple Birth Association. So in Toronto, it's the Tapumba. Ottawa has one as well. They often have semi-annual, they're called swap sales.
Yeah.
Where all of the parents of multiples who are part of the group label and bring in all of the stuff that they're ready to get rid of. And most of these groups reserve at least part of the shopping time only for parents of multiples, and then often open it up to the public. So as a parent of a singleton, I will say I totally took advantage of these sales because it was a fantastic place for me to get clothes for my kids because they go through them so fast and or they grow out of them so fast and there is nothing wrong with the piece of clothing. So I often take advantage of these sales. And I would go with friends who are parents of multiples, or I would go later on in the day on my own. But they often have this sort of reserved hour. And you can, for the parents who want like the matching outfits and all of that, it's there because these are all parents of multiples. And you're able to find a lot of that fun stuff. You're able to find some products that are specifically geared to twins. So things like twin breastfeeding pillows that are larger, that are meant to be able to support 2 babies.
Twin the carriers as well. Like you can, I mean, you can use like multiple carriers different ways, but you can also get the actual like twin carriers. that are
Now,
like front and
you're
back.
a baby wearing expert here, so this might be like draw it down and fight this one out. I will always tell people that every baby needs their own carrier. And this was the line that changed about 5 years ago from the American Baby Wearing School, where they used to say, like with the Mobies, you could put one baby on either side.
Yeah, one on the front and one on the back, yeah.
Well, with Mobies, you can't do the back, but you could,
I'm thinking of the Maytais.
Yeah, so Maytais, one on the back and one on the front, or woven wraps. I have a picture somewhere. I should put it up in our stories. I have a picture where I was babysitting another baby in our apartment, and I had her on my back and Quentin on my front, and they were both about a year old, and it was a whole lot of baby.
It's a lot of it's just a lot of fabric too.
Yeah, and I was using 2 woven wraps, so it was just fabric and child everywhere. But I have this picture. So anybody who's not following us on social, I will make sure that goes up in our stories on Toronto Family Doulas, so you can see how ridiculous I looked.
Full of baby.
Full of baby. It's a lot easier when they're smaller. I will be honest, I hate the twins carriers.
So I find them really cumbersome and really, really expensive. So even when you go to put them on, it's like, I don't even know how to explain it. It's like how it must feel when you put on armor or something, right? It's a lot of clips. There's a lot of straps. And
this sounds terrible, but they make me think of saddlebags.
Yeah, and almost you really need the manual. Most people can put on a baby carrier just with common sense. You're just okay, I think this is how it goes. This is where the clip goes or whatever. But with the twin carriers, it's where does this clip go? Where does this clip go? And it's really confusing.
They're definitely a product that honestly I would recommend skipping. A double breastfeeding pillow, if you're planning to breastfeed, phenomenal investment. The carriers, they're only really good when babies are small. They really do look like saddlebags or panniers. They sort of kind of looks like they hang off a boob, one off of each. But that's not how a person, an adult center of gravity sits. So it can be extremely hard on the back. It can be I've seen people who feel really unbalanced just even walking because the babies move, and the babies move differently. So if you step or shift at the wrong point, the bigger your baby is, the more they can sort of throw you off balance. In places like Ontario, where we spend 5 months of the year navigating icy sidewalks, that's not necessarily the safest plan. So for really small babies, I often find that 2 babies in a carrier is a bit much, especially if you're recovering from a cesarean birth. So I often tell people to have both a double or triple or whatever stroller you need and a single stroller. And I often suggest putting 1 baby in a carrier and one
in the stroller. Yeah, absolutely.
The ability to put your diaper bag somewhere instead of having to carry it and 2 babies in a carrier. So it gives you some storage capacity. It gives you some time with that sort of close skin to skin-ish type time with one of the babies, and then you can swap out later. And if you just, if you choose not to go with a single stroller and you have the double, you also always have the option of taking the baby out of the carrier if you get tired, or assuming the world opens up and stops being a dumpster fire at some point. Maybe you want to sit down at a restaurant and eat your lunch with a friend, and you want both babies. So having those strollers is an option. Having carriers are a fantastic tool with multiples, because there's always going to be a fussy baby, probably both, but sometimes just one. And so having a carrier is a tool, but having both babies in the same carrier can get complicated. For that reason, you don't need multiple carriers if you're only going to carry 1 baby at a time, or you might want to look at 2 different types of carriers. So having a buckle carrier that when your babies are older, you can put baby on your back, and then something like a Maytai for the front, or a woven wrap. Ring slings are really popular with twins. You can do crisscrossing ring slings and have a baby on each hip. Really cumbersome, because babies that can sit like that are bigger babies, but it is possible.
Yeah, the only thing I would suggest, like especially with people who have twins who are like really, really little, is you can do like the stretchy Moby wraps or the boba wraps. And for like a short period of time, you can put each baby on one side. But this is like a sick, like maybe anything from 4 to like 8 pounds is kind of your max per baby. So if you need that, like if you want to hold them both together in those really early days, you can absolutely do that. But then obviously just use your stretchy wrap for one baby after.
I always, when you're doing that with the 2 babies, I always recommend viewing it as kangaroo care versus baby wearing. So kangaroo care, for anyone who doesn't know, this is the idea of skin to skin, baby kangaroo, like the Joeys, the baby kangaroos, in their mom's pouches. Same idea. It's about having baby sort of bundled up against your chest and your skin. It's extremely beneficial for premature babies in particular. Really helps them to regulate their temperature and their heart rate and to stimulate feeding and all of that. So it's highly encouraged in NICUs. And so treating that sort of double baby wearing as kangaroo care, meaning you're sitting on your butt and you're marathoning working moms, and you know you've got your bottle of water and your basket of snacks, and you're just going to sit there for an hour or two. That's when you can do that. There are also kangaroo care shirts. I was looking up products earlier. There are actually twin ones now. You sort of almost like a tank top that you sort of shove baby in. Yes. Now there's ones that have 2 pockets. Again, saddlebags. Yeah. There's like a divider down the middle to help keep the babies from sort of smushing and falling into each other. So it helps to keep them separate, which will help to keep those airways clear, which is our big concern when we've got 2 babies in a row.
Yes, absolutely. Yeah. Yeah.
And then let's have a quick talk about breastfeeding. We're coming up on an hour. Obviously, this is a topic we could talk for days and days on. Yeah. If you are not following our social media, we are sharing tips and tricks and information on multiples all this week. So make sure you are following Toronto Family Doulas, Family Doulas of Ottawa, Hamilton Family Doulas, and Birth and Baby Talk, so that you can make sure you get all of the different pieces of information that are being shared across the board. But breastfeeding multiples is a whole conversation, and we could probably have Britt on and do a whole episode on this. Yeah. But if you want to breastfeed multiples, it's not impossible. It's not easy. And there is often supplementation involved, but you can do it. It is possible to exclusively breastfeed twins. It is possible to primarily feed other types of multiples with breast milk. One of my favorite things is when we talk to people about breastfeeding twins, and you're like, 2 breasts, 2 babies, right? So like logically it makes sense, right? It's just all about kind of the logistics of it. And you talked about like the twin nursing pillows. You can also buy, there's a really cool nursing pillow called the Nicu. No, you've probably seen it with the buckwheat holes in them. No. Really? Oh, okay. I'll send you a link. These are kind of like the best breastfeeding pillows out there because you can kind of mold them. They're really heavy. Good, because everybody buys the My Breast Friend ones, and I hate
no.
pillows with a passion.
Yeah. So these ones, they're almost like long tubes, but they're kind of heavy. They're really breathable, and you can actually, if you put one on either side, they're actually like one of the best ones I've seen for twins. So
we will make sure we get that link included, whether it is in the handout or the newsletter or down in the comments, because even a doula of 8 years can learn something new today.
There you go.
Most people get the My Breast Friend. I will be honest, buy whatever when Meaghan is talking about. I hate My Breast Friend pillows. I don't find them particularly helpful.
They're like hard.
Twins.
Yeah.
I find them, they have such a limited sort of, I'll call it lifespan. I find once babies have reached a certain size, they're no longer comfortable or convenient. I hate them. Other people love them, and like lactation consultants recommend them all the time. I'm like, why? They're just one more thing you have to futz with when you've got a screaming baby who wants a boob in their mouth.
Yeah.
But The other thing that's really important if you are planning to breastfeed or provide breast milk to multiples is a good quality pump. This is not the time to chintz out. This is not the cheap out. This is not buying the pump and style Medela that you can get at Bye Bye Baby. This is rent a hospital grade pump time.
Yeah.
And I say that in all honesty. That being said, I have had multiple clients have extremely good success with Amida breast pumps, not Medela. The Amida.
Oh, so I've had the opposite. Where I've had clients who've had really good experiences with some of the Medela pumps.
Hospital Medela pumps, yes.
But not the Symphony, but the pump and style. Yeah.
So funny. I had one client who was literally on a baby gear rental website at 2:00 in the morning, emergency ordering a rental Amida pump. Because she couldn't get anything with the Medela. Like she half an hour and didn't get anything. And I was there helping her. So it wasn't user error. This was not, because user error happens, right?
Yeah.
This was not a user error. This was not, the pump was a problem. This was, she didn't produce for this pump.
Wow.
So I've had more success with Amida pumps.
Okay.
But I will say the best success, whether it is a Medela or an Amida, whatever, the hospital, some shops also rent breast pumps. And some baby stores rent breast pumps. So a hospital grade rental pump is worth the investment if you are planning to provide breast milk to multiples.
Absolutely, yeah.
Huge difference.
And you will have enough. I think a lot of people are worried that they won't produce enough milk, but you have multiples. There's a good chance you're going to produce enough milk. But having said that, there are a lot of multiples who spend time in the NICU, which do have to be supplemented either, to gain weight. Sometimes it's an iron fortification. So sometimes it's a real kind of cocktail, if you will, of milk in the bottle.
If you want to breastfeed your multiples and your babies are in the NICU, it's super important that you ask the NICU nurses to match you up with a certified lactation consultant as quickly as possible and to set you up with a hospital pump for while you are there. Every NICU I have ever encountered has a place for parents to label and store breast milk for their babies, and hospitals will always check to see if there is breast milk provided before they give a baby formula. Now, they might need to add fortifier if your baby was extremely premature, but they will always try and use the breast milk first. Other thing I want to say, just because I always want to make this caveat, if you are having multiples and you don't want to breastfeed, that is okay. Twins, triplets, quads, there is a lot of work involved. There are twice as many babies. And if the idea of it being able to just push a button on, say, a baby Brezza, and then push another button and then put the lids on and you have 2 bottles ready to go in less than 5 minutes, if that sounds to you like the best way forward for your family, that is the best way forward for your family.
Absolutely.
You do not have to breastfeed any baby, but you definitely don't have to breastfeed your multiples if you don't want to. And as I tell all of my clients, I promise you that when they start kindergarten, you will not be able to tell which kids were breastfed and which kids weren't. They are all going to be covered in dirt. They are all going to be yelling their heads off. They're all going to have runny noses. It doesn't matter how they
It's okay. Yeah.
So you don't have to breastfeed. There are other tools on the market, like the table for 2 is a really popular one. It looks like 2 sort of bouncy chairs hooked up side by side with a little bit of space between them, so you can sort of feed both babies in front of you. And so those are really, there's also a pillow one that's similar. It helps keep babies a little bit propped up. So you don't have to do it, but you can feed them. Things like the baby Brezza, which pre-mix your formula and preheat your water and do all of that, are also tools that are helpful. I am going to give the same caveat for bottles that I give for every time we talk about bottle feeding babies. Don't buy Dr. Brown's. Buy ones that have fewer pieces to clean, because when you are feeding multiples, you have twice as many bottles. And if there's 6 pieces of bottle to clean every time you have to clean the bottle, that's a lot of bottle parts to watch. The best advice with both baby gear and also just the way you live your life with multiples is the path of least resistance. there's enough within the life of parenting multiples that are challenging, that are stressful, that are additional concerns that parents of singletons don't have. Don't make your life eat harder by picking the most difficult path, unless it's something that's super important to you, and then we support you in picking the harder path. But for most situations, go the path of least resistance, go the way that works best for you, because you don't need extras on top of the additional sort of challenges you're already facing.
And the last thing that I want to mention before we go is I want to just like add to like what you just said about taking the path of least resistance. If you're able to and you're comfortable with it, and I'm not just saying this because we are doulas, but you should hire a postpartum doula. We love working with twins, and especially the overnights. If you have to like be up multiple times during the night, feeding, changing, cleaning bottles, if you're able to, definitely outsource that situation.
Absolutely. I will second that. Whether it is overnight so that parents can get some sleep. We've also had clients who have asked our doulas to come in during the day and really just help them establish and create and set up routine.
Or like bathing even. Like sometimes I literally have been there for just like bathing.
Yeah.
Because it is like a whole situation when there's multiple babies. Yeah.
Absolutely. So it's, having an extra set of hands, especially if your partner has to go back to work, especially in the time of COVID where grandparents and aunts and uncles and good friends can't come over and help you out in the same way. Doulas all of our doulas and all of our agencies have taken infection prevention and control certifications. They are all trained. They all know how to work with twins and triplets. So our doulas, and we also have really stringent safety protocols around COVID and virus control and transmission. As much as we possibly can, we follow the same guidelines that public service workers follow. And so, having a doula come in is sometimes the best option, not only to really sort of get a handle on routines and life with multiples, but also to make sure that you get the time to heal and to recover, to sleep, to take care of yourself, and to enjoy your
babies. Yeah. Yeah.
The twins are really challenging in the beginning, but the silver lining comes a little bit down the road where they have built-in playmates. Yeah. Where they're never alone. You can put the two of them down to play together and go and make dinner, and they will entertain each other.
Yeah.
And there's a bunch of stuff coming up, like cryptophagia. I did a whole post on cryptophagia that's coming up, which is the secret language of twins. Like there's a whole word for it. Babies, multiples often create really long-standing, established, strong bonds with each other. And that becomes a huge benefit down the road. Makes it a bit challenging in the beginning, but there is a benefit to that bond as your babies get older. And it often makes them a bit more independent than singleton babies because they have a built-in playmate.
Yeah, absolutely.
All right. Thank you so much. Obviously, Meaghan and I could wax poetic on this for days and days. Next week's show, we are having Cree Lambic back. I loved chatting with Cree a few months ago. We had a fantastic conversation about just dealing with COVID and being a parent in COVID and all of the stresses and anxieties that came with that. But now Cree is coming back. She's going to talk about recognizing postpartum mood disorders, especially in a COVID world where if you've ever seen those memes that go around, it's like, I don't know if this is my seasonal depression or my post-holiday depression or my regular anxiety or my COVID anxiety. Add parenting on top of that, and you have a perfect storm. So we will be back. We are looking forward to chatting with her. Please make sure you are signed up for our newsletter so you can absolutely get that handout that is coming out in the next few days, I believe tomorrow, on what you need 2 of or 3 of or 4 of, extras of, and what you can either skip or you really only need 1 of. And every week there is a newsletter that comes out with printables or information on us so you can get to know us, as well as local information in your area. So make sure you are signed up for that and you are registered on following us on all of our socials so you can also get all the information there. And thank you for joining us. We will see you next week.
Awesome. Bye, everyone.